the sun come up, I'll be there to say what up in the morning.
Hey everyone, Dr. Jagoda here. Welcome back, and today we're going to discuss releasing the QL or the quadratus lumborum. And the QL is really important because it plays a huge clinical significance with regard to low back pain. So what we're going to do is we're going to discuss the anatomy, and we're going to show you how to stretch this on a seated position. The reason I'm doing seated is because it's really easy to access, and you don't have to go through this lengthy process of going on the floor. We will show that in the future, but we don't have to go on the floor. This is probably really helpful for you guys at home who maybe need a chair, don't want to get on the floor, maybe they're having too much back pain to get on that floor, or maybe if you're in an office and you really have some low back tightness and you want to do this while you're seated. So the QL will attach, it's an accessory respiratory muscle, so it's going to attach to the rib, the spine, and then down to the pelvis. So a muscle that's in spasm can actually pull your hip up like that, giving that appearance that you have a high hip on one side or a high ilium on one side. And so what we're going to do is we're going to grab the edge of a table, the edge of a chair, something particularly not with armrests, so that this way what we're going to do is we're going to drop our hip down. So if this is the side that's in spasm and it's up higher like this, what we're going to do is we're going to drop that hip downward up to the floor. So you come close to the edge of the bench here. You're going to drop that hip downward. So you can kind of see this motion's kind of subtle. So what you'll do is drop that hip down to the floor, and you're going to lean away a little bit. And if you can get that arm over your head and really pull it across. And with this other arm, I'm either going to do one of two things. I'm going to stabilize so I don't fall over, or I'm going to actually stabilize and pull. So I'm going to pull downward to help that motion going over. Again, I'm going to show you from the back. It's going to look like this type of motion. So we will sit our butt almost halfway, if not a little bit more than halfway off, give or take. Drop that hip down, hold and stabilize, reach over. And that is a really, really good stretch right there. And you can really feel it. And I'm going to just show you from a different angle, kind of off to the side a little bit. So I will be off to the side, over here, drop that hip, hold, pull, and really up and over. The better you have a good posture, if you really focus on lifting up your sternum, lifting up your spine, you are going to also raise up the rib cage. Again, this muscle does attach to the rib cage, so if you raise up your rib cage, you're going to be lengthening that a little bit more effectively. So again, finally, drop this over, stabilize, pull over, try to maintain a good spine, good posture, and then really reach over. And if you need to move over again with this arm, that's okay. And then come back down. When you're doing this type of stretch, you're really going to want to focus on this stretch for probably at least 15 to 30 seconds. Repeat that anywhere between 2 and 4 times. Alright guys, so hopefully this will help release your low back tension and give you some relief of that low back pain so that you can do this in a seated position. Thanks again for stopping by. I'll see you next time guys. Thanks.